Hello, I'm Congressman Ted Lieu. Thank you so much for joining us at this webinar on federal funding, as well as hearing about the effects of the Trump administration's unconstitutional attempt to freeze federal funding. We have some amazing witnesses with us here today, and you're going to hear about their amazing organizations and the services that they provide. I want to just first start off by saying that the Constitution is very clear. The framers gave the House of Representatives the power of their purse. It is Congress that decides the appropriations, and it's Congress that passes an annual budget. And it would completely render the legislative branch irrelevant if the president could simply choose what the president wants to spend money on. So we every year go through these huge budget battles and appropriations fights to say, look, we want to spend X amount of money here, and we'll cut some money in this other place, and then we're going to compromise in this other area. All of that will go out the window if the president could say, well, I don't really care what you all decided. I'm just going to decide for myself what each person gets or each entity gets in any particular line item. That is completely unconstitutional. Beyond the Constitution is also a federal law that Congress passed because Richard Nixon tried to do this, and we passed the Empowerment Act, which basically also says you can't do this, Mr. President. You can't just decide to not spend the money that Congress, through budget battles, decided to appropriate. And it is something that is brazenly unconstitutional. And the funding freeze itself is unconstitutional. Because of the public pushback and pressure, the administration walked back their OMB memo that froze all funding. However, they are so chaotic and really not very competent at all that it appears that there's still some funding freezes going on, and we're still trying to get down to the bottom of it because there's still some folks that are not getting funding. And so we have folks here today who are going to talk about the importance of federal funding and what this freeze or potential freeze in the future could do to the services that they provide to so many people. And with that, I'm going to have our first witness speak, and it's going to be Dr. Mitesh Popat, who became Chief Executive Officer of Venice Family Clinic on December 12th, 2022. He comes to us from Marin Community Clinics in Marin County, California, where he was CEO for 5 years. He has extensive experience as a community health executive, board-certified family physician, public health expert, and health care technology advisor. With a passion for how technology can help break down barriers to care and reach people in novel ways, he has served as an advisor to several health tech companies. He also has been a commissioner with Partnership Health Plan of California, a managed Medi-Cal plan that covers 550,000 people in 14 California counties. So if you would like to start, that'd be fantastic.
Congressman, thank you for inviting us today to join and to share our story. And the story that I would tell is the one of our communities that we serve and the patients that are potentially adversely impacted by such actions as you described. The community members who come to Venice Family Clinic, and there are north of 45,000 of them who come to seek medical services, behavioral health services, educational services through our Head Start programs, substance use services, homeless outreach. We meet people where they are in the communities where we serve them. And to have that at risk is unconscionable. To have that even in question is quite concerning to us at the clinic. We are service providers for those who have the least and often need the most. And so I would just like to say that I stand tall with you and our colleagues and our partners in saying that this is not okay. This is something we need to have clarity on. Normally, we tend to lean on our federal partners to be at our sides, to be the wind in our sails, to help us meet our mission, to be part of that coalition of community health centers that are serving communities across the country in need. There are 1,400 federally qualified health centers nationally, 15,000 service sites in all communities that are blue, red, and purple. We are not after a political purpose. We're here as, again, as service providers to help those most in need. So again, specifically to funding sources that could be at risk or in jeopardy, we receive funding through various federal grants, including through HRSA, Office of Head Start, SAMHSA, USDA, and surely others that I haven't had a chance to look at the whole long list of federal grants that we receive. And we pride ourselves on being very good stewards of federal dollars and the impact we make on local communities. So thank you again, and appreciate you talking to us today.
Thank you so much, Dr. Popat, for participating today and for your leadership and service. Next, we have Dr. Shannon Whaley. She is the Director of Research and Evaluation for PHFE WIC, the largest local agency WIC program in the nation. Dr. Whaley's expertise is in the planning, development, and evaluation of programs designed to optimize the healthy development of children and families served by WIC. During her 26 years with WIC, her work has spanned a broad range of topics, including childhood nutrition and obesity, promotion of early literacy for low-income children, and the impacts of nutrition education, breastfeeding support, and the WIC food package on WIC participants. Dr. Whaley, if you'd like to give some remarks, that'd be great.
Thank you, Congressman Lieu. I really appreciate the invitation today and to meet the rest of your participants here today. As your constituent, about an hour ago, I got my Lieu review for the week. I read those eagerly each time and really appreciate your dogged determination to protect our communities that need the most support. So for those of you less familiar with WIC, the Special Supplemental Nutrition Program for Women, Infants, and Children, thankfully we call it WIC, because that's a pretty big name, serves about 7 million pregnant and postpartum women, infants, and children who are low income. That happens every month. We serve these families, and they access nutritious food, nutrition education, breastfeeding support, and healthcare referrals. So we're a close adjunct to healthcare. It's nice to meet you, Dr. Popat, because Venice Family Clinic is very much a good friend of ours, along with the rest of you on this call. So nearly half of all infants born in the United States are served by WIC. Half of all infants born in Los Angeles County are served by WIC. Numerous studies from around the country, and I don't have time to go into them today, all the details, but countless studies, including from our team here at PHFE, have documented significant economic impacts of the program and health impacts associated with WIC program participation. Every dollar we invest in WIC saves at least $2.48 down the road in attendant healthcare costs. This is a prevention program. Prenatal participation is associated with vastly improved birth outcomes, and WIC participation through age 5, which is when children are no longer eligible at that age, is associated with vastly improved household food security and nutrition security, improved dietary intake, and lifelong health outcomes that are optimal for children. We know that investments in the early years just carry through for the rest of our lives. So funding, let's talk about that. All WIC funding is federal. It comes from the U.S. Department of Agriculture, and as Congressman Lieu said, is appropriated by Congress every year. This is a congressional decision. California serves the largest number of WIC participants in the country. Los Angeles County, guess what, is the biggest county in the country, serving the most participants, and therefore receives the largest proportion of the about $7 billion of federal funding that was allocated nationally across the country for this fiscal year that we're in right now. So how do those federal funds work? What do they pay for? The majority of those federal funds pay for food. These are highly nutritious foods that are known to be deficient in, frankly, most of our diets, but particularly necessary for pregnant women, postpartum women, infants, and children. What are those foods? They are vegetables, they are fruits, they are eggs, milk, cheese, healthy breakfast cereal, beans, peanut butter. These are the foods, frankly, that all of us should be eating. All of us should eat like WIC. So the majority of these federal funds are paying for these healthy foods for pregnant and postpartum women and children up to the age of 5 who are living in low-income households. So the other portion of federal funds pay for this incredibly impactful nutrition education and breastfeeding support that's provided to every WIC participant. Here in LA County, that's over 275,000 people. Across the country, it's close to 7 million people. And it's that combination of the healthy foods paired with that nutrition education and breastfeeding support. That's really what makes WIC the premier public health nutrition program in the United States. So the disruption this week has been chaotic. That's a generous word. Disrupting benefits has widespread consequences. It not only affects all those participants I just talked about, those 275,000 here in LA and the almost 7 million across the country, but it affects the producers of food, the farmers who are growing the fruits and vegetables, the retailers who are selling these foods, the community partners in the local economy. Just in LA County, every month, $9 million is spent just on the fruits and vegetables that WIC provides. Another at least 9 million is for the rest of those foods. Just the impact on the local economy spreads far beyond the WIC participant. Just a quick story. On Tuesday, a very tough day, we had a participant call at around noon saying, I've heard the news. I can't get to the store by 5 p.m. Am I going to have food for my child? This is not acceptable. So in closing, many of you on this call, many of you who are listening, you have children. You remember when you were pregnant, or your partner was pregnant, or your daughter was pregnant. We all have family. We all have families. This is what brings us together. You remember the days of early infancy and early childhood and how essential that supportive community was for you in knowing how to feed your child, how to care for your child, how to support your child. That is what WIC is for families. It's this crucial support network from the prenatal period through age 5 that ensures women and children get the healthy nutrition they need and the support they need. That sets the stage for a lifetime of good health. Thank you. I'd welcome any questions. And again, really appreciate being here today.
Thank you so much, Dr. Whaley, for your presentation and for your leadership. Next, we're going to hear from Dr. Harlan Levine. He is President of Health Innovation and Policy at City of Hope. He also serves as a chair of the board of Access Hope, a spin-out company from City of Hope that is focused on serving the employer market and making leading-edge cancer care available to all, regardless of geographical location. He also is currently a board member and secretary for Bioscience LA, a member of the Keck Graduate Institute's Board of Trustees, and a board member for Vita Health, Active Life Scientific, and Reimagine Care. And for 10 years, he has been a strategic advisor to the founder chairman of the Board of Quantum Health, and now chairs its external clinical advisory board. Dr. Levine?
Good afternoon, Congressman Lieu, and thank you so much for inviting me, giving me an opportunity to speak to this group. I represent and president of Innovation and Health Policy at City of Hope. For those of you who are not familiar with City of Hope, we are a National Cancer Institute designated comprehensive cancer center and ranked as one of the top 5 cancer centers in the country. We have over 30 sites in Southern California as well, and as being in states in Georgia, Illinois, and Arizona. We conduct research that's important to all of us. Our labs decades ago invented human synthetic insulin that takes care of millions of type 1 diabetics across the world, and more recently have been involved in developing drugs that are some of the most important classes of drugs in cancer care today: monoclonal antibodies, CAR T cells, and many other subclasses classes as well. In our research, we invest in population health, genomic research, new diagnostics for cancer, new therapies for cancer, but also studying how cancer affects different subpopulations differently, so we can learn how to care for everyone who has cancer across the country and across the world. We receive roughly $100 million in NIH grants, and the threat here was to cut off that funding, which would affect not only our institution, but institutions across the country and so many people who benefit from the research. More than that, there are people who are doing the work in these labs who depend on this funding. And the previous speakers both talk about disruption. Clearly, this disrupts the research in the future, but this causes chaos and disruption for those who are doing the work today and depend on the commitments that were made by the government to support their research for a fixed period of time. So we appreciate the opportunity just to clarify and emphasize the importance that this cancer research has for all of us across the country. And we really, we need to expect more from our government to continue the funding. I focused on cancer. I want to also highlight that we do important research in the area of type 1 diabetes. We mentioned the insulin as well. We're actively and uniquely studying the metabolic intersection between cancer and diabetes, so we can help those with diabetes who often with treatments will have a higher risk of cancer, and those with cancer who often get knocked into diabetes, that we can identify opportunities to prevent the disease from expanding in each of those populations. So thank you for the opportunity to address this group, and we really hope that the government will rally around supporting the importance of research in cancer and diabetes.
Thank you so much, Dr. Levine. Really appreciate your presentation and your service. Next, we'll hear from Sonny Wang. He is currently the Water Utilities Manager for the City of Santa Monica, where he leads the city's water and wastewater utility. He led the city's efforts to increase local water supplies, such as the award-winning Sustainable Water Infrastructure Project that leverages stormwater, urban runoff, and municipal wastewater to produce purified water used to recharge local groundwater supplies, and the first full-scale flow reversal reverse osmosis system in the United States. Sonny?
Thank you, Congressman Lieu, for having me, and I'm honored to be on this panel with everyone this afternoon. I'm here representing sort of the water wastewater industry, and we're often the least thought about commodity. I think most people think that when you turn on the faucet, water comes out, but one of the things we often struggle with is balancing the affordability of water and how finding ways to fund major infrastructure upgrades to replace our aging infrastructure, addressing climate change impacts on our water supply, and how to handle water supply resiliency. Behind me is one of the projects that you mentioned in the intro. With this project, we're able to capture stormwater, urban runoff when it's available, just like this recent storm, and purify that and alter that and to supplement local drinking water supply. When that's not available, we're able to leverage municipal wastewater to purify that to recharge our local groundwater aquifers. A project like this is able to leverage multiple sources of water to supplement our traditional water supplies, and projects like these would not be possible without outside funding and support, because we often collect water rates, pennies on the gallons, to supply that to our customers. So to fund large infrastructure projects, like there's one we're looking at where we currently receive federal support, is looking at resiliency of our water supply to rehabilitate our water storage reservoir. And given the recent wildfire events in the region, that's ever more important to bolster the resiliency of a local water supply. And we really rely on the federal and outside assistance to do that, because if you look at our Fort water storage reservoir, it's going to cost over $100 million. It's nearly impossible for a utility to come up with that kind of funding through just water rates. So having outside assistance allow us to rehabilitate our energy infrastructure, to provide security on our water supply for our residents, really to help accelerate these programs at all. Without federal assistance, to rehabilitate those 4 reservoirs would take over 20, 25 years, saving pennies on a gallon every time to save up that money to pay for that. Without federal assistance, we could cut that time in half and do it much more quicker, and to ensure our communities have a resilient water supply that supports pretty much everything, right? Water is essential to life. So thank you for the opportunity to shed some light on that as well, and the importance of receiving federal support for projects like local water and wastewater projects.
Thank you so much, Sonny. Really appreciate your service and leadership as well. And our last presenter is going to be Tom Backley. He is the Chief Executive Officer of Beach Cities Health District, where he has served since November 2016. In his role, he provides strategic leadership and direction to all functions of one of the nation's largest preventative health agencies, and manages $90 million in assets, 170 employees, and 1,000 volunteers. Tom?
Good afternoon, Congressman. I just want to start by saying thank you to you, and also to the federal government for your investment in the local community. And that's going to be kind of a theme of my remarks. The federal government has invested largely in youth here in the beach cities. And so we represent 3 beach cities just south of LAX in Los Angeles. We focus on preventative health. We've been doing that for 25 years, and our top health priority is mental health and substance use. And so through the Drug-Free Communities Grant, Washington invested in our youth, and we've been able over the last 5 years to reduce substance use with alcohol, cannabis, and tobacco. And so we've been able to do that. We were recently awarded another grant for another 5 years there. And obviously the money is important. It helps us to provide those programs, but it really creates that initiative and momentum for us as a local community to invest our resources as well as work with partners. Some of them are on the call here with us today. So my short message would be it's working. You know, Washington has invested in us and we've delivered, and we want that to continue, obviously, for the next 5 years. One of the things that the Drug-Free Communities Grant has really sort of catapulted is this concept of ALCO, which is a youth mental health facility. It's one of 3 in the state of California. This is following a model that's very successful in Australia, Ireland. They have 150 of these outlets. And the idea is that you create a space for youth aged 12 to 25 where they can come in without the stigma of mental health and receive free mental health services. And so we're able to do that through a grant that we used for capital construction to get this going. And what we did is we brought in the youth and we asked them what they wanted. And anybody that's ever been involved with youth programs know that they don't work unless you get the buy-in and trust of the youth. And so through that program, we have 25 youth advisors that help us with ALCO. We've been up and running for 2 years. We've had 10,000 youth visits in a little over 2 years. And so it's working. And I guess I would just sort of end with, you know, as we talk about what's next and trying to fund a permanent location and continue this commitment to youth mental health. I see Venice Family Health Clinic is here. They're one of our partners in ALCO. You know, as we continue this commitment, you know, when I'm standing there in front of 25 youth and they're looking at me and, you know, they want to know if I'm for real, you know, and they want to know if I'm going to do what I say I'm going to do. And so I think as we have these disruptions, yes, the money is extremely important, but it's that sort of that trust and that confidence that we're going to do what we say we're going to do. And you know, every time I meet with them, you know, we've developed that trust, and it's working. They've on a grassroots level just formed these clubs at their schools, you know, these ALCO clubs. And so as we all, anybody with children or youth know, it's often hard to you know, have them initiate things, but boy, they have grabbed this and run thanks to the investment initially from the federal government. And so we want to continue that partnership, continue that investment, and continuing to deliver the results and improve youth mental health for all. We're hoping to be an example of perhaps this happening nationwide, certainly throughout California. We're partnering with Stanford, and we hope that these efforts will continue and we'll be able to provide these services.
Thank you, Tom, for your presentation and your leadership. I had the honor of visiting ALCO and having been able to see the amazing program, and just very pleased we're able to get funding to the Beach Cities Health District through the community funded projects grant.
Yes, thank you for that. That was a good day. You spent most of the day with us. That was a good day.
Thank you. So I have a few questions. The first is to Dr. Whaley. You had mentioned about the parent who was unable to get to the store in time. Curious, because it's been so chaotic, they did eventually resend the complete across the board funding freeze. Did that come in time for this parent to get their food that she needed?
It's such a good question, Congressman Lieu, and really from Monday night when this dropped till Wednesday at around 10:15 when it was mysteriously rescinded was a great period of complete unknownness on our part. So we continued to direct participants, please come in for your services, please shop. The California State WIC director, Fariha Chowdhury, is excellent. And she immediately worked with all the vendors to say, keep business as usual until we know otherwise, because frankly, no one could understand what had been put out. And the specificity around if it's direct payments to individuals, then you're not affected. Well, WIC is not a direct payment to an individual. It's a grant to the state, to the locals. So it was incredibly challenging and unknown. That mother absolutely could have shopped. We never had a stoppage of the ability to shop for food, thank goodness. I don't know what would have happened if it hadn't been rescinded on Wednesday morning, but we absolutely can't get put in a position like this again. I think what's most interesting to me is WIC had celebrated its 50-year anniversary last year. For 50 years, this has been a program with bipartisan support. It has never been a political program. So we are really in uncharted territory right now. And anything that makes rapid changes like this, that just has the potential to impact, almost 7 million families in our country, that to me is quite unacceptable. So as you kicked off at the top of the hour, these are congressional funding decisions, and we work very closely with you and your staffers and staffers from around this country every year to keep you educated about what the WIC program is and what the needs are. It's an excellent process, and we need to continue with the process that exists for funding these programs.
Thank you. I want folks to understand one of the reasons that the order was rescinded was because of the enormous pushback across America. One of my favorite quotes is from Abraham Lincoln, who said that public sentiment is everything. With it, nothing can fail. Without it, nothing can succeed. So I want people to understand the power to shape public sentiment. You can call the White House. You can write letters to the editor. It does turn out that a bunch of folks do write letters to the editor, but often it comes from the same folks. So if you start writing in, you're going to be able to get published and to change hearts and minds. You can do social media. It's free. So if you write an interesting post, maybe someone in Kentucky will read it, or Florida, or Oregon. So understand your power to shape public sentiment. My second question goes to Sunny Wang. The administration will make allegations, and they'll say things like, well, we're going to basically make sure that no funding, goes to the Green New Deal. First, I just want people to understand there was no law of the Green New Deal. The Green New Deal never became law. In fact, it was never even, put to a floor vote. So it literally doesn't exist. Yet, I'm curious, Sunny, are you concerned that because what the water utility does, and part of what you do is in fact conservation and environmentally related kinds of policies, that you might also be caught up in not getting funding because of that?
I can't comment politically. I think as a professional in the water industry, I think is often misunderstood. They try to connect all that together, but at the end of the day, is everybody needs water, right? Whether how you use it, how efficiently you use it, where the source come from. Different areas have to adapt differently to climate change. I think is understanding that issue and not get caught up in the politics of that, because at the end of the day, we all need water. And that's where the starting point needs to be, understanding what it's used for and what it's good for.
Thank you. Appreciate that. My next question is for Dr. Levine. Part of the freeze applied to NIH grants, including for cancer research. What is your view of what that would do if, in fact, NIH either would no longer be allowed to give grants for cancer research or had to pause their grants for cancer research?
Right. So, Congressman, I think those are two different issues. I want to say I do not believe the federal government intends to cut off funding for cancer research. I think this was a broader action where perhaps all the consequences weren't thought through. If that research were to be cut off, we basically are going to turn what has been a great movie over the last 3 decades, where we've reduced cancer mortality by over 30%, to a snapshot where we're going to freeze where we are in time in terms of our ability to diagnose and treat cancer. And given that millions of people have developed cancer or have cancer, and there will be tens of millions that are cancer survivors, this research really affects many, a large portion of Americans, and the research needs to take place. But I don't really see that happening. I think the request that we have is to try to avoid these disruptions. So first of all, people's lives are impacted. Commitments were made. We're not even talking about the freeze on meetings and messaging where new grants aren't being reviewed. We're just talking about in this OMB memo was, ongoing commitments. And we just feel that we're back on the right course, that this was too disruptive and we need to restore funding. And luckily, City of Hope made the commitment that we were going to continue the research through this tumultuous period anyway. So we did not have an interruption, but there are a lot of other institutions, not just smaller ones, but some of our peer institutions don't have the funding to manage through the cash flow. So this is a really important issue to researchers across the country. In terms of the long term, I have all the confidence that we, as we heard earlier, cancer is not a red or a blue issue. It's a global challenge for all of us, and I really do have confidence that we'll continue to invest in cancer. Yeah, and if not, I hope, to your point, Congressman, people will advocate on their own behalves and change the minds of the administration. But I remain more optimistic. I think we're worried about process, and we want to make sure that research can go on to identify challenging issues and address healthcare disparities and health inequities throughout our country. And we do want research investment to continue to be made from the federal government in studying those issues as well.
Thank you, Dr. Levine. And your bringing up healthcare disparities makes me sort of ask this question. For clinical trials, do researchers try to make an effort, or their programs make an effort to make sure that they're broad-based, and so that includes a variety of races as well as different sort of ethnicities and so on?
Yes, more and more that's become an emphasis of clinical trials, and I do believe that understanding how we can improve the health of all Americans will remain a focus of everyone, all administrations going forward. But I think, again, we need to be clear that we don't want to politicize the research we do to reduce health equities. We want to focus on the fact that health equities exist. All people deserve to have access to good health. And quite frankly, doing research in those areas allows us to detect cancer earlier, make better diagnoses, and then have more effective treatments, which then drives the affordability and quality agendas as well. So if we want to make America healthy again, we want to make sure we have solutions that can address all subpopulations of America.
Thank you so much. I just want to note that the executive order regarding DEI is so broad that it potentially would apply to folks who try to do health equity, to folks who try to have clinical trials that are more representative of the population. It is a rather very ludicrously broad executive order, and our hope is that the administration will understand that what they're proposing could have extremely harmful effects to millions of Americans. So, Dr. Popat, question for you. How much of what you do with the Venice Family Clinic relies or depends on Medicaid?
Oh, a substantial portion, probably 50% of our funding in one way or another is tied up directly or indirectly in Medicaid, and whether it's due to funds that are flowing from as a joint federal state program, some of our funds, due to our federally qualified health center status, are due to our federal status, but then the dollars flow through the Medicaid program. But a substantial percentage of our funds, I think, are, because out of our patient population, probably north of 70% have our patients on Medicaid and on Medi-Cal in California.
Thank you. So, as all of you know, the administration was so incompetent, they didn't know if the order applied to Medicaid. Regardless of that, there is going to be a big budget battle coming up, and the administration, as well as Republicans, are going to try to put in severe cuts to Medicaid. And one of the reasons that that's going to happen is because what they're saying is, oh, we don't want to, cut the Defense Department. We don't want to, cut, for example, they don't cut the VA. And if they don't, do these things, then it turns out that the only amount of discretionary funding left is about, 15, 20%, of which Medicaid is in that. And so they're basically going to be decimating the entire rest of government if they say they're not going to make cuts to these very, very large entities. So not clear how the Republicans are going to get to the number they want to get to if they hold that line. It seems just mathematically impossible unless you wipe out Medicaid or just have unacceptable cuts. So it's a big budget battle coming forward, and any stories that you can provide us will be very helpful that we can share about the importance of Medicaid funding. And it's such a broad program. Not only does it help Venice Family Clinic, it also, right, helps, provide funding for, suicide prevention programs that veterans, also, take part in, or opioid prevention programs. This whole lot of things that Medicaid helps that people may not know about. So it'd be helpful to get stories. And then with that, Tom, want to thank you for your leadership of the Beach Cities Health District. I'm going to give you the last word, and I'm going to have you tell us, as you sort of look in the future, what are some of the one or two challenges that you're facing as the health district?
Yeah, our biggest challenge here in the South Bay and surrounding communities, through these funds, we've been able to provide services to adjacent communities such as Inglewood and Carson and Hawthorne, where they've partnered with us like we did during the pandemic when we all came together and we were able to combine resources and serve all communities. And for us, mental health is really the challenge. And I think most of us would agree that that's an area that needs to be changed, and we're working on that together. And through the grants that you've made available and the federal government has made available, we're starting to look at that through a partnership model where you have local community-based organizations like us, the federal government, the state, as well as the medical community, all coming together to address that issue of mental health. And I think we're going to need to partner on that and do it deliberately and do it consistently. And so that is a huge challenge I see, and one that we have an opportunity to address many of the downstream mental health issues early with our youth. And so that's what we're focusing on. And I think that'll be a challenge for the future. And so if we're in as a partner, and like I said, it's been working, and hopefully it'll stay steady and predictable, and we can make the changes that are needed to improve not only children's health, but everyone's health.
So I want to thank all of you for your presentations and for your leadership. I really appreciate you doing this. And again, I just want to conclude with letting people know that you have the power to help shape public sentiment. Please understand that power, and please fight to make sure that we have an America that is an even better place to live, work, and play. Thank you for participating, and have a good day.